The United States saw its overall case numbers surge to beyond 12 million over the weekend, adding an astronomical 3 million new cases in just the 22 days of November. With the positive sentiment around vaccine approval, just a first step in a months-long process to arrest this virus in country.
If approved, they could be used for immunization in the U.S. population in the month of December. And we plan to have enough vaccine doses available for use in the U.S. population to immunize about 20 million individuals in the month of December, and another 25 to 30 million per month on an ongoing basis from there on. And as of the month of February or March, if we have more vaccines approved, such as the live vectored vaccine, we may be able to immunize a larger number of Americans on an ongoing basis per month.
That is all good news, but public health experts here continue to impress on the wider population that the vaccine and its distribution around the country is no silver bullet. That 20 million, maybe up to 40 million doses available by the end of December will have limited impact in a country of 330 million. And with the Thanksgiving holiday weekend upon us later this week, Americans are being urged to limit travel around the country and to cap their family gatherings, as daily case numbers have remained above 150,000 for the past week and expected to rise. With hospitalizations at above 80,000, a new record nationally, and at least 1,500 deaths per day for 5 of the last 6 days. Catastrophic, in a word.
We need to actually double down on the public health measures as we're waiting for that help to come, which will be soon. We'll be getting vaccine doses into people at high priority at the end of December. We're not talking about shutting down the country. We're not talking about locking down. We're talking about intensifying the simple public health measures that we all talk about. Mask wearing, staying distance, avoiding congregate settings, doing things to the extent that we can outdoors versus indoors. If we do that, we'll be able to hold things off until the vaccine comes.
While officials have indicated that they have a national distribution strategy in place that will be ready to go once emergency use authorization has been received from the FDA.
We're bringing together all the requirements for administering the vaccine, and then we're sending it down to the distribution sites. Any place that a state wants to administer the vaccine, as long as they're enrolled, right, into our process, we can distribute the vaccine. We can distribute the Pfizer vaccine at a minimum of 975 doses and the Moderna vaccine at a minimum of 100 doses. We can go to one place in the state, or we can go to 10,000 places in the state. The capability and the capacity exist because we came together in a whole of America approach.
States, in consultation with the Centers for Disease Control and the FDA, will decide on who gets a vaccine first, with frontline health workers and other high-risk groups likely to be at the front of the line, meaning access for the vast majority of Americans will be a few months away at best. Sherman Riceby's SABC News, New York.